Stop! Before you swing your legs out of bed tomorrow morning, I want you to think about your abdominal wall. Are you sitting straight up like you're doing a gym crunch? If so, you might be accidentally setting yourself up for years of postnatal struggles. Welcome to the show. Today we are diving deep into a topic that doesn't get nearly enough real talk in the prenatal classes. We're talking about the 7 common pregnancy mistakes that can significantly raise your risk of postnatal complications, like urinary incontinence, abdominal separation, and even pelvic organ prolapse. We are joined today by the insights of physiotherapist Meghan Stephenson, who has dedicated her career to helping women navigate the physical demands of pregnancy. Now, let's be very clear from the jump. Many post-birth complications are simply unavoidable. Genetics, the size of your baby, and the length of your labor play massive roles. But, and this is a huge but, how you move your body during those 40 weeks of gestation matters more than you've been told. Whether you're walking through Central Park in New York or navigating the hilly streets of San Francisco, your daily movement patterns are either protecting your pelvic floor or putting it under unnecessary siege. Did you know that nearly 60% of women experience some level of diastasis recti, that's the separation of the abdominal muscles, after pregnancy? And about 1 in 3 women will experience urinary incontinence at some point postpartum. In places like France, pelvic floor physical therapy is a standard, government-funded part of postpartum care. But here in the United States, we're often just told to do some Kegels and sent on our way. This lack of guidance leads to mistake number 1, and it's the most common one I see from Chicago to Los Angeles. Mistake number 1, the sit-up roll. Imagine this. It's 3 a.m. Your bladder is screaming, and you need to get out of bed. Most women sit straight up, using their core muscles to propel their heavy torso forward. When you do this, especially in the 2nd and 3rd trimesters, you create an immense amount of internal pressure. If you look down at your belly while doing this, you might see a ridge or a cone popping out along the midline of your stomach. This is called doming. Every time you dome, you are stretching the connective tissue between your abs, the linea alba. Over time, this prevents that tissue from healing after birth, leading to a permanent mom pooch and a weakened core that can't support your back. Instead, Meghan Stephenson suggests the log roll. It sounds simple, but it's a game changer. You roll onto your side, use your arms to push your upper body up, and let your legs swing off the bed simultaneously. This bypasses the direct strain on your abdominals. Think of it like a crane lifting a load from the side rather than a lever trying to snap upward. If you're in a high-pressure job in a city like Chicago, rushing to get ready, you might think you don't have time for this. But those extra 2 seconds are the difference between a functional core and a year of physical therapy later. Mistake number 2, holding your breath during exertion. Have you ever caught yourself holding your breath when you lift a heavy grocery bag or pick up your toddler? This is known as the Valsalva Maneuver. In the weightlifting world, it's used to stabilize the spine, but in a pregnant body, it's like putting a cap on a soda bottle and then squeezing the middle. That pressure has to go somewhere, and usually it goes straight down onto your pelvic floor. When you hold your breath while lifting, you are essentially bearing down on your bladder and uterus. This is a primary driver for developing a prolapse, where the pelvic organs begin to drop. Meghan's golden rule is blow before you go. This means you should start exhaling before you initiate the lift and continue exhaling through the hardest part of the movement. If you're lifting a stroller into the trunk of your car in a busy New York parking garage, exhale. If you're picking up a laundry basket, exhale. By breathing out, you allow your diaphragm to rise, which naturally lifts the pelvic floor and reduces the internal pressure. Mistake number 3, the Supermom lift. We've all seen it, or done it. You're at the grocery store, maybe a Whole Foods in LA, and you're trying to carry 4 bags in one hand while balancing a toddler on your hip. Pregnancy hormones, specifically relaxin, make your ligaments much softer and more pliable. This is great for birth, but terrible for stability. When you lift heavy objects with poor form, you aren't just straining your muscles, you're tugging on your joints. Meghan points out that many women experience pelvic girdle pain because they continue to move as if their body hasn't changed. If you're lifting something, get close to it. Squat down with a wide base, keep your chest up, and use those glutes. Avoid the hinge and reach move, where you bend at the waist with straight legs. This puts all the torque on your lower back and the front of your pelvis. I remember a client, let's call her Sarah, who lived in a walk-up apartment in Brooklyn. She insisted on carrying her heavy deliveries up 3 flights of stairs in one go. By her 7th month, she could barely walk due to pubic symphysis dysfunction. Once she started breaking the loads into smaller trips and focusing on her breathing, her pain decreased by 50% within a week. Mistake number 4, ignoring the heaviness. This is a tough one because we're often told that pregnancy is supposed to be uncomfortable, but there is a specific type of discomfort you should never ignore. If you feel a sensation of heaviness or fullness in your pelvic floor, as if something is falling out, your body is giving you a high priority warning. This often happens after a long walk or a day spent standing on your feet. In our culture, we praise the woman who keeps going until the very end. But pushing through this heaviness is a massive mistake. It indicates that your pelvic floor is fatigued and can no longer support the weight of your growing baby. When you feel this, you need to get horizontal. Lie down with your hips slightly elevated on a pillow. This uses gravity to give your pelvic floor a break. Meghan suggests that if you're planning a big day out, say walking around the Santa Monica Pier, plan for gravity breaks every hour. Don't wait for the pain to start. Prevent it by unloading the pressure early and often. Mistake number 5, the Donald Duck posture. As your belly grows, your center of gravity shifts forward. To compensate, many women arch their lower backs, stick their butts out, and let their ribs flare open. This is often called lower cross syndrome, or, more colloquially, the Donald Duck stance. While it might feel like you're balancing the load, you're actually turning off your core and your glutes. When your ribs are flared and your pelvis is tilted forward, your diaphragm and pelvic floor are no longer stacked on top of each other. They're like 2 pistons that are out of alignment. This prevents your core from working automatically. To fix this, think about tucking your tailbone just slightly and pulling your front ribs down toward your hip bones. You want your canister, your torso, to be straight. This alignment protects your lower back from the chronic aching that many pregnant women in office jobs in Chicago complain about after sitting at a desk all day. Mistake number 6, high-impact panic workouts. Sometimes, when women start to feel their bodies changing, they panic and try to work out harder to maintain control. They might keep up their high-impact running, or HIIT classes, deep into the 2nd trimester without any modifications. Now, exercise is amazing for pregnancy, but impact is a different story. Every time your foot hits the pavement during a run, that force is multiplied and sent directly to your pelvic floor, which is already carrying 10 to 20 extra pounds of baby, placenta, and fluid. Meghan Stephenson recommends switching to low-impact, high-stability movements as you get heavier. Think swimming, prenatal yoga, or stationary cycling. If you love the intensity, focus on slow, controlled resistance training. One of my favorite stories is about a marathon runner in Seattle who switched to power walking and specialized pelvic floor exercises during her 2nd trimester. She was worried she'd lose her fitness, but because she protected her core, she was back to running safely just 4 months postpartum, while her peers who pushed through were dealing with stress incontinence for a year. Mistake number 7, the toilet strain. Okay, we have to talk about it. Constipation is a hallmark of pregnancy, thanks to high progesterone levels. Many women make the mistake of straining or pushing to have a bowel movement. This is essentially a high-intensity workout for your pelvic floor in the worst way possible. Straining can cause hemorrhoids, but more importantly, it can significantly weaken the levator ani muscles, the very muscles you need for a smooth delivery and recovery. The solution? Use a squatty potty or a simple footstool. Elevating your knees above your hips straightens the anorectal angle, allowing things to move without effort. And remember that blow before you go rule? It applies here too. Never hold your breath. Instead, try making a moo sound or a low growl. It sounds ridiculous, but it prevents you from closing your throat and bearing down. Let's look at the science. A landmark study published in the American Journal of Obstetrics and Gynecology tracked over 800 women. They found that those who received pelvic floor muscle training and movement modification education during pregnancy had a significantly lower rate of urinary incontinence both in late pregnancy and 6 months postpartum. The difference wasn't just small, it was statistically massive. These women weren't doing hours of exercise. They were just changing how they moved during their daily lives. Imagine your body as a house. Pregnancy is like adding a massive new floor to that house. If you don't reinforce the foundation and the support beams, the house will start to creak, the walls will crack, and eventually, things might fail. These 7 mistakes are the cracks in the foundation. By avoiding them, you're not just having a better pregnancy, you're ensuring that your body can return to its full strength after the construction is over. So, let's recap the Meghan Stephenson plan for a safer postnatal recovery. First, log roll out of bed every single time. Second, exhale on exertion, blow before you go. Third, stop the Supermom lifting. Ask for help or break up the loads. Fourth, listen to the heaviness and take gravity breaks. Fifth, fix your posture. Stack your ribs over your pelvis. Sixth, trade the high-impact jumps for stable strength. And seventh, stop straining on the toilet. Use a stool and breathe. It's about mindfulness, not perfection. You're going to forget sometimes. You're going to be in a rush in a New York subway and forget to breathe while lifting your bag. That's okay. The goal is to make these movements your new normal. When you change the way you move, you change the way you heal. Your body is doing something miraculous. Give it the support it deserves. If you found this helpful, share it with a friend who's expecting. We need to change the conversation around pregnancy from just surviving to thriving and protecting our long-term health. You've got this, and your pelvic floor will thank you. Until next time, keep moving with intention.